Edmonton Freedom Central reporting live from Calgary, Alberta today at the Worldwide Freedom Rally on November the 20th. Right now we have Dr. Nagase, am I saying that correctly? Dr. Nagase, the very famous doctor who treated 3 of his patients with ivermectin and they survived. He is a hero for all Canadians right now, and we are so very fortunate to have him here. Dr. Nagase, we noticed that you were creating some attention in North Vancouver a couple of days ago with the stillborn babies in the hospital there. Can you tell us a little bit about the outcome of that?
From one of the local doctors in North Vancouver, Dr. Mel Bruchet. He has contacts all through Vancouver, and some doulas who work in Women and Children's Hospital, which isn't in North Vancouver, it's in Vancouver. It's one of the birthing centers for Vancouver. They had 13 stillbirths in a 24-hour period. That was what I heard. But the thing is, I've also heard a similar story out in Waterloo, Ontario. So in Waterloo, Ontario, I have a more reliable statistic that there was 86 stillbirths between January and July. And normally it's only 5 or 6 stillbirths every year. So about 1 stillbirth every 2 months is the usual rate. So to suddenly get to 86 stillbirths in 6 months, that's highly unusual. But the confirmation, the most important confirmation that we have from the Waterloo, Ontario report was that all of the 86 stillbirths were fully vaccinated.
Fully vaccinated mothers.
That's right.
So we're seeing a correlation.
We're seeing a correlation. And certainly when you see a correlation, then you have to start asking, in the water in Waterloo, is there something, is there something in the air? Is there some toxin in the food supply? But when you see the same correlation in different parts of the country, in Vancouver, and then in Waterloo, and you see an increase in stillbirths, you have to ask yourself what is going on that is both in Waterloo, Ontario, and Vancouver, BC, that is suddenly causing an increase in stillbirths.
So we need to demand some answers as Canadians. What can we do? What can we do, Dr. Nagase?
Well, we need to get freedom of information requests. We need doctors, nurses, unit clerks at hospitals to start printing out the statistics. Because we know if we ask the health authorities to print out the statistics, they will refuse. And that is absolutely criminal. Because who pays for the hospitals? We do. It is our information. We own that information. We should not be asking some administrator for permission to get the death statistics. We should not have to ask some kind of health minister for permission to get the actual rate of ICU stays. Well, they're saying it's unvaccinated people, but there's so many people who are within 2 weeks of their second shot and they are getting deathly ill. This information is our information. We deserve to know how many percent of the ICU is filled with people who are having side effects within 1 week of the injection. And then if they're clogging the ICUs because they're getting a vaccine injury, but then they're being labeled as unvaccinated, that is an absolute lie. We have the right to all the information and all the details.